What's up, Doc Mike? Today's topic, July 24, 2020 Project BBLC-19. Battle Cry, Box and Break the Liabilities of COVID-19 at the Barangay Level Now. Warning, if we fail, it would mean thousands of Filipinos needlessly dying soon nationwide. The continuing serious effects in the Philippines of the worldwide pandemic due to COVID-19 confirms that contagious illnesses can spread in a rapid pace and elucidates how the disease-causing agents are commonly transferred. The World Health Organization, the health departments of the world states, and epidemic and new disease research institutions here and abroad, including our own Department of Health and Research Institute for Tropical Medicine, as well as Philippine academic institutions, are presently rushing significant studies of the disease. These centers of health concerns commonly recognize that the virus causing the COVID-19 disease spreads through body fluids discharged by an infected person that subsequently get into the body system of a new host person, and the general public has now been made to understand, and it is increasingly being accepted, that the common vehicles of transfer of the disease are almost invisible droplets of saliva or mucus that are discharged when a virus-carrying person coughs, sneezes, or simply talks verbally, among others. Scientists are now increasingly reporting that through the said simple verbal conversations and discharges, the virus lingers in the air or is carried possibly even by aerosols for some time and for distances of up to 6 feet and sometimes more, or it settles and is maintained for even longer times on various surfaces. The danger of such a contagious disease is worsened when, like the COVID-19, it can possibly be transferred by a carrier that is asymptomatic, or one who does not show the symptoms of the disease, and said unknowing carrier spreads the disease by simple conversation or regular interaction with other people in the community. The whole world is now witness to the gravity of the adverse effects of an epidemic, or even worse, a pandemic such as the COVID-19 pandemic. Health and allied health institutions and their workers are swamped to capacity and overworked with sick persons to treat. Deaths are reported daily in substantial and shocking numbers. Communities and families are quarantined, sometimes with necessary force, within the boundaries of localities and families within their abodes. Businesses can be closed and may only be gradually reopened and expectedly with great losses, and the economies of nations are seriously endangered, and these scenarios are accepted to continue until scientists find a cure or vaccine to control the disease and until governments find recovery solutions to the detrimental effects. It is now accepted that the COVID-19 disease will have to be managed in communities for some time until it comes under control and in order that a deadly resurgence of the disease will be obviated. The entire world also now gets a new lesson that future microbes can cause similar contagions. Fortunately, it has also been demonstrated that the strict practice of mandatory minimum health standards, wearing of face masks, washing of hands, social distancing, and other quarantine protocols as directed, required by government for everybody to do, offers to some extent valuable protection versus COVID-19 infections. However, when the rapid and uncontrolled spread of the coronavirus cannot be effectively mitigated or controlled due to failure to implement and enforce these same minimum health standards for everyone, in order to flatten the so-called epidemiologic curve, the country's healthcare system will surely be negatively affected as it becomes overwhelmed, resulting to many needless deaths among Filipinos in the entire country. The barangay is the basic unit of Philippine society, and it usually is a prudent policy to follow that crucial, high-impact national programs or projects, in this case on the health and lives of the Filipino people, be piloted, tested, and perfected first from this basic unit, micro level, called the barangay, before it can be elevated or expanded in a massive national scale, macro level, to effectively streamline that national project or program in order to ensure its resounding success nationwide. Due to the national state of public health emergency declared by President Rodrigo R. Duterte, Presidential Proclamations Numbers 922 and 929 dated March 8 and 16, 2020 respectively, there is an urgent need to institute crucial and effective measures immediately that will allow and support the safe interaction of the Filipino people in the conduct of their daily lives, focused among others on complementing and enhancing mitigation measures against the deadly spread of COVID-19 will result in enormous and needless deaths of our people countrywide. Currently, there is no sustained, unified and institutionalized, national or local program existing at the level of the barangay that can scientifically and effectively influence, motivate, elicit, positively change the human perception, behavior, attitude or activity, actions and or reactions of Filipinos towards the critical common goal of working in unison to help delay, control, stop, or immediately neutralize the rapid rise of the deadly spread of the coronavirus that is now seriously unfolding into an alarming rate nationwide and if not properly addressed can lead soon to the overheating or overwhelming of the Philippine healthcare system that will surely result in thousands of Filipino deaths nationwide. This is the missing factor that our government must realize now, that is crucial as to why our government failed to sustain the flattening the epidemiologic curve when it declared a strict nationwide lockdown since March 2020, in its quest to balance economic realities for the country vis-a-vis the clear and present danger of this COVID-19 public health emergency that threatens valuable human life. With the correct program instituted at the barangay level, both human life and our nation's economic life can equally be served. All these must start in the barangay, the basic unit of Philippine society. Department of the Interior and local government, in consultation, intensive collaboration and partnership with other national and local government agencies including non-government organizations coming from the private sector must immediately create and implement a holistic, all-encompassing, comprehensive, inclusive, and result-bound programs under a concept of public-private engagement or arrangement targeting and focused at the barangay level to implement, operationalized and sustain mitigating actions, measures or steps to immediately delay, control and stop the spread of COVID-19 infection to protect and save precious lives in the Philippines. The said multi-sector barangay-level COVID-19 mitigation and prevention program or project utilizes or employs the broadest available human knowledge, strategies, techniques, methodologies, science, interfaith beliefs, orientations, military and police ops, etc. including the required technology, resources, and assets to affect general human behavior and the specific desired changes aspired from a person or community, in this case the barangay, so that maximum compliance and sustainability in the implementation of the mandatory minimum health standards or protocol required by government will be adhered to, all the time, by everyone in the barangay with total social acceptability, respect, humanity and with full adherence to law and order, including corresponding penalties if ever the law is otherwise violated. Here are the targets of the project. From national and local personalities starting from His Excellency, President Rodrigo Duterte, to government organizations and non-government organizations, and others. This program or project will be called simply BBLC-19 with the battle cry, Box and Break the Liabilities of COVID-19 at the Barangay Now, a joint governmental inter-agency, with required private sector partnerships, sustained activity done during the period of the pandemic towards the new normal Philippine realities brought about by the COVID-19 crisis in our nation. This will be spearheaded, operationalized, monitored and supervised on the national level by the DILG Office of the Undersecretary for Barangay Affairs, however locally implemented, manifested in each barangay, completely considering the unique situation and setup of each barangay. It will also be laterally supported and collaborated by all national and local government agencies, utilizing its own independent agency resources, however simultaneously will also be supported by resources from the private sector volunteering to participate in this multi-sector barangay level BBLC-19 project. Concept of operations, BBLC-19 will have a timeline of 2 years from the date of approval and will be conducted in 3 phases, Phase 1 recruitment, training, operationalization. In anticipation for the upgrading of NCR to MECQ or ECQ status on August 1, 2020. Timeline, July 24 to July 31, 2020. Special note, if government wants people to stay at home, government must give them a good reason to do so. Example, what benefits people will gain, personal development, entertainment, etc. to make them comply. Phase 2 Identification of pilot barangays. Timeline, July 27, 2020. Target, NCR care of MMDA and LGU. Phase 3 Full nationwide operations, until 2022. Timeline, August 15 to August 31, 2020.